Good afternoon, everybody, and welcome to the Arizona State Board of Pharmacy special meeting. Today is September 17th, 2025, and the time is 2 p.m. My name is Lori Walmsley, and I'll call the meeting to order. Dr. Gandhi, if you could do roll call and conflicts of interest, please.
Certainly, Madam Chair. Thank you. Mr. Braswell?
Here, no conflicts, but I am having video issues, so I will be off camera.
Sure. Mr. Thorwald?
Here, no conflicts.
Ms. Browning? Ms. Davis? Ms. Walmsley?
Present, no conflicts.
Ms. Spark?
Present, no conflicts.
Mr. Hogan?
Present, no conflicts.
Mr. Al-Nassif?
Here, no conflicts.
Mr. Anderson?
Here, no conflicts.
We do have a quorum, Madam Chair, with 2 absence.
Thank you, Dr. Gandhi. If I could get a motion to approve the meeting minutes, which is the video stream of the September 12th meeting.
So moved.
Approve.
I have a motion and a second. All those in favor?
Aye.
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 Any opposed? Hearing none, motion carries. Dr. Gandhi, if you want to do a little bit of a summary of why we're here today, and what we need to accomplish with the updated protocol.
Certainly, Madam Chair. Thank you. The reason for this follow-up call related to the protocol is because there was an adjustment that was recommended by one of the audience members. And when we reviewed that, we realized we needed to modify other sections. And then as we were doing that, Department of Health Services reached out and said, we need you to broaden the age range going down to 6 months because they were doing a standing order that encompassed multiple disciplines, not just the Board of Pharmacy. And so we expanded the recommendations and the charts to all the way down to 6 years of age, which was beyond what the board had approved last week. And therefore, we had to call an emergency meeting because it was a significant change. So my ask today is for you to review the protocol, to approve the protocol, and to allow DHS and myself to continue to work with it to make adjustments as they see fit that fits their standing order and any provisions they would like to amend in our protocol.
Dr. Gandhi, you said you expand to 6 months or 6 years?
6 months.
6
Pharmacy
months. You said 6 years. Yeah.
and older, but COVID, I think, starts at 6 months and older. So since physicians will be leveraging the standing order, nurse practitioners and so forth, they asked us to expand it down to six months.
Ms. Walmsley, I have a comment.
Swamsley's on mute.
All right. I just, the former protocol was specific for pharmacists and pharmacy. And I thought it was really well designed because it only showed that age of 6, whereas this one does show those younger ages. My concern would be just for safety and for pharmacists is that when they're reviewing this protocol, that they may have a misbelief that they're eligible to administer to those younger ages when we certainly don't want them to do that. So because of that kind of safety concern, is there an opportunity to keep the existing one that we approved for pharmacists and then just have this one for other vaccinators? I just don't want our pharmacists to be set up by looking at this protocol and administering a vaccine to a younger child than they're permitted to do so.
There is a statement that says that for a reminder, for pharmacists, it only allows for 6 years and older. So it does say that on there, but I understand where your concern is, Jeff.
The standing order that DHS would put out, and totally agree with you, we don't want to create confusion. But the standing order that DHS would put out would carve out that pharmacists can only administer 6 years and older.
Okay. And just like comment, Dr. Gandhi, please correct me if I'm wrong, like this standing order, it doesn't mean the pharmacist has to administer the vaccine. Still, they work under what they believe is right for patients.
And ultimately, it's still a clinical professional judgment decision that they have to make.
Cool.
This just gives them the authority in an event that someone is qualified that they can do it. Versus right now, they're not able to unless they have a prescription.
I guess, Dr. Gandhi, one other question, just curious question is, why would providers and nurse practitioners need a standing protocol when they're authorized to order this vaccine themselves without protocol from Department of Health Services?
I asked that very question to DHS, and it was answered in a very vague way, which I generally don't understand to this point. But I would assume that it has something to do with they don't want their name associated with the vaccine because it's a highly volatile subject matter across the country. And if you can put it under DHS and the medical director or whoever's signing off on the standing order, then it kind of keeps them out of the limelight. It's my assumption.
I would voice the same concerns that Mr. Anderson voiced. If something can be misconstrued, it will be misconstrued. And all I would suggest is that there be added clarity at the very beginning that this order is pharmacists can only go to age 6, and others have the freedom to go to 6 months. And I would make that very, very clear right up front. Otherwise, it will get confused.
I have seen the standing order written by, but it was marked confidential, so not able to share it through DHS. I don't have their permission. But it is identified in the very beginning of the standing order that pharmacists can only administer 6 years and older. It's on the very first page.
And I believe we can post it also in our website, right? State Board of Pharmacy.
I am certain as we maneuver through this time that we're going to have to formulate an FAQ on our website. So we will start working on that preemptively anyways, just to get ahead of it. But the challenge, Mr. Anderson, to kind of further answer your question is, it would get even muddier if we had multiple protocols attached to a standing order versus having one.
I get where DHS is coming from, but I also understand the concerns that are being raised by the other board members. So I'm supportive of moving forward with this version of the protocol and giving you whatever authority that you need, Dr. Gandhi, to continue to make modifications in the interim. And then in parallel, working on some FAQs that we can put out to the public to make sure that it's really clear for pharmacists to ensure that they're following all of the appropriate laws and regulations.
Question. I'm happy with what you said about DHS and what Ms. Wombley said about it this as well, but within the protocol itself, can we clearly state that same thing at the very beginning, that this is what this is for and who can do what and what they cannot do? It's just a backup or a duplication in this case, to me, seems like it would eliminate a lot of potential problems in the future.
I agree with Mr. Thorwald. I think that I don't want to see complaints coming forward to this board for pharmacists administering vaccines to younger children when they're not authorized to do so. But us providing or endorsing or posting a protocol that includes age ranges that clearly are not permitted for them to administer on our website. So I understand that we're gonna try to mitigate that, but having this document with all those age ranges in there just implies to the end user that that they have the authority to do that. And I don't want them to be burned by the language in the protocol or how it could be construed.
I'm perfectly fine with approving this as long as there is something in there at the top that just truly states that. That's my opinion.
Yeah, as I learn about the final draft that DHS has put together, we'll certainly bring it back. Maybe we'll agendize it for a quick call on the 25th, because I think some of you guys are going to be on that call for just a quick 5-minute discussion, 10-minute discussion before we do the hearing. So that you guys can cast your eyes on what I'm talking about. We'll further educate, as my compliance officers out there, they'll educate the individual pharmacist, and we'll put out some communication as well to make sure the pharmacies understand their authority is only 6 years and older.
Yeah, I would just like to add comments that, like if you look at the protocol at authority, so it says here, physician, nurse practitioner, physician assistant, advanced practice registered nurse, all of them can prescribe. The only outliner is the pharmacist, as Dr. Anderson says, right? So the authority, and you go like everyone 6 months, but not pharmacist 6 years. You know what I mean? It's just like, just to add. There's a conflict itself between the authority as in the protocol and what we allow and not allow. You know what I mean? So just to bring it, but I totally support just to make it like one protocol for all health caregiver, or like so be like less confusion.
Yeah, I support that as well. And one of the questions I think may come up though with just talking about under the protocol or what's allowed by prescription. We're just getting, I'm hearing of a lot of questions just around what pharmacists can administer by prescription. So if we're putting together FAQ, something of that sort, just to maybe include that as a reminder, just to help educate. Just getting a lot of questions. So if it's down to 6, we still may get questions about if pharmacists can administer younger than that pursuant to a prescription from a provider. So just wanted to throw that out there for consideration.
Certainly. If you guys are getting any questions, if you can send them to me, maybe we can add those to the FAQs and kind of get ahead of it. We hear some questions, but we're obviously, you guys
Yeah.
know a lot more than we do, and it'd be
Because I mean, under authority, if I see like RNs or LPN, that will make sense. So we have like not only pharmacists involved, but it doesn't show RN, because what I see, only RN and LPN, they need this standing order. But all the other professionals, they have already a power, they don't need a standing order.
yeah.
Under authority, there's no RN, there is no LPN.
That's going beyond our scope at this point.
Yeah. I'm just like, to point it out.
Yep.
But I totally support, you know what I mean? Like, as long as we make it clear for our pharmacists what they can do, what they cannot.
So just to reiterate, the ask is to approve the protocol, work with DHS to modify according to their needs. I can assure you the charts and stuff will not change. That will be static, but the verbiage throughout may adjust a little bit. They based on their standing order, because they're going to integrate our work and their work and put it together and hopefully create a smart document. So that's the ask.
So I will make my motion, Dr. Gandhi, like I move to approve the protocol and give authority for board staff to work with Department of Health. And my motion include approve our board staff to do any modification to the protocol.
Second.
Any discussion? All those in favor?
Aye.
Aye. Any opposed? Motion carries. I know it's not agendized, but I'm sure the public probably has a lot of questions still about where we're at with the process. Since it's the same topic, are we able to give an update as to where the emergency rules are and when we think this will all be active for use.
So the emergency rules were sent to the AGO yesterday. The individual, Ms. Galvin, reviewing those rules sent back some questions, concerns. I've been working on that today. And I believe we may have a resolution. I don't know, but I sent those back to Ms. Galvin for review this afternoon. So once she's concluded her review, it would take probably today, tomorrow. Then it'll boil up to her superiors for final review and sign off, hopefully. And then once they sign off on it, I believe it's in effect, would it not be?
They will sign off on it, and then it has to be filed with the Secretary of State to be effective. And they are on alert that a package should be coming over, and that can be done very quickly.
So
And then the protocol still needs to be issued by DHS, right? Which hasn't been done yet either.
no, there's obviously an urgency with the governor's office to get this done ASAP. I think the initial deadline was last night, but we had this meeting today, so they may have had to push it off a little bit longer. Right at the conclusion of this call, I'll have to inform DHS that you guys have approved this protocol. A draft was sent to them for their review because I know they have a lot of legwork to do behind the scenes. So they may have started integrating that information already, waiting for my final say as to the board has approved it.
And Dr. Gandhi, just for pharmacists, like understanding what the standing order is a prescription, so the COVID still required prescription. Is that correct? And the standing order can be used as a prescription to meet the requirement.
In a nutshell, standing order is going to be defined as a prescription order.
Yeah.
Does not require doctor-patient relationship.
Correct. And the prescriber will be whoever signed the protocol or the standing order.
Correct. Does that answer your question, Ms. Walmsley?
Yes, thank you for the update. And I think that'll help the public understand where we're at still. Is that it on our agenda for today? I think that's all we had.
That's all we had. I think we had solicitation from the public and so forth last week because it pertained to rules. These protocols are just protocols. They're information that was gathered from the vendors and experts. So.
Okay, so we can adjourn. I appreciate everybody's attendance on last minute and look forward to the staff continuing to work on this important issue. Thanks all.
Thank you.
Bye.
Bye.